Hello YouTube, this is Anthony, and as many of you know, a little over a year ago I recorded two videos of my recovery from a laparoscopic inguinal hernia repair operation. And I wanted to thank all of you for viewing it. Between my two videos, I have received about 13,000 views to date, and I certainly hope that the information was helpful to you. There were several good questions left in my comments in the comments area of the video, so I wanted to go over a few of those. But before that, I wanted to offer a shout out to one of the viewer named SARO12700225. I had left a teaser at the end of the second video that perhaps there would be a day 3 recovery video, and there wasn't. So Saro put part 3 ... He died. Well, thank you, Sorrow, for that comment, but I'm not dead. I'm still here, and I'm doing quite well. And I would like to answer several of your questions from the people that have left comments on my videos. The first one comes from Ricky, and Ricky asked, do you think I need somebody to take care of me after the surgery, or can I take care of myself? When I had my surgery, I was all by myself as well, and I did just fine. As a matter of fact, I had my surgery on a Thursday or a Friday, and I was back to work the following Monday. Now, the doctor didn't recommend that, but I didn't have any more sick time, so I had to do that anyway. What I did is I brought my TV downstairs before the surgery and set a little living space close to the kitchen and the restroom, and I just stayed downstairs for those next 3 days and did minimal moving. I just got up if I needed to eat something. And when it was time to prepare the meals, it was something quick and easy like a can of soup or a microwave meal. And I was able to do that. Also, he asked if I recommended the mesh or the non-mesh approach. I got the mesh and I don't have any complaints about it. I did, however, feel it for about the first, I'd say 4 or 5 or even 6 months. And I talked to the surgeon, and he said that there's a nerve that goes through that area where the typical male hernia is, and that it sometimes will kind of get intertangled in that mesh. And so what I did is I just stretched it out the way that it hurt a little bit, and after a little bit of time, that pain did actually go away, and everything was fine as far as that's concerned. I've read a lot of negative stuff about the mesh, but my experience has not been such. I don't have any more pain. And as far as the hernia is concerned, I'm fine and I check out today. Some of you guys asked about the cost of the hernia. And obviously, in different geographic areas, the cost will be different, and also depending on the surgery and what kind of anesthesia, etc. you have. And also another thing is it's hard to get an accurate cost because I got bills from all kinds of different sources. Off the top of my head, I remember getting bills from the doctor or the surgeon. There was a surgeon's assistant that also sent a bill. There was the anesthesiologist, and the hospital all sent me different bills. And as far as I'm able to determine, the total amount of the surgery was around $20,000. Now, if you have a good insurance plan, as I did at the time, your expenses, your out-of-pocket expenses will be much less than that. If I remember correctly, mine was probably between $3,000 and $5,000, which is still a pretty chunk of change, but it was by no means the entire amount, thank goodness. And one other tip that I would give you is I tried on Netflix to watch some comedy after my surgery. A belly laugh is not a good thing to do, so if you're going to be watching TV, try to stay away from something that will give you a belly laugh. If you wouldn't have learned this from me, you would learn it the first time you give one after your surgery. It definitely is not very fun. But once you recover, you can subscribe to my new comedy channel, LOL with Anthony, and just laugh your little heart out. Please like this video if you liked it, and subscribe to this channel, Brent Anthelneth, as well. I appreciate your views again. I hope this is helpful. Please leave any other questions that you might have in the comments, and I'll be glad to answer them for you. Thank you.